Hello everyone, I'm Mary Rose Corrigan, Public Health Specialist for the City of Dubuque with a May 29, 2020 COVID-19 update from the Dubuque County Public Health Incident Management Team. Dubuque County added 7 new COVID-19 cases since my report yesterday. As of May 29th, Dubuque County has 341 positive COVID-19 cases. That's a rate of 352 per 100,000 population. There were no additional deaths reported, so Dubuque continues with a total of 18 deaths. 5,341 people have been tested in Dubuque County. That's about 1 in 18 people. And about 6% of the cases tested have been positive. 5 individuals are currently hospitalized, and 163 people, or about 48% of Dubuque County positive cases, have recovered to date. 911 Dubuque County residents have had serology or antibody testing. 56 of those, or about 6%, have tested positive for COVID-19 antibodies. The state added 325 cases since yesterday. As of May 29, 2020, Iowa has a total of 18,898 positive cases. In all, about 1 in 21 Iowans have been tested, and about 13% of Iowans tested have been positive. 18 additional deaths were reported in the state since yesterday for a total of 522 Iowans. 47% of all Iowa deaths due to COVID-19 are in those 80 years old and older. And Iowa currently has 38 long-term care outbreaks, with Dubuque County having one of those outbreaks. 47% of Iowa deaths are residents in long-term care facilities. Currently, 376 cases are hospitalized throughout the state, and 51 of these are in Region 6, where Dubuque is, with 0 admissions to the Region 6 hospitalizations in the last 24 hours. Finally, 10,711, or 57% of Iowans, have recovered. Every day I give the number of Dubuque and Iowa cases that are recovered. I received a question about what does recovered mean. Recovered numbers come through the contact tracing process. At the end of the isolation period for a positive COVID-19 patient, they are contacted by the Iowa Department of Public Health contact tracing staff to assess their symptoms and to see if they've met the recovery criteria. That is, fever-free for at least 3 days or 72 hours without the use of fever-reducing medications, that their symptoms have improved, for instance, when their cough or shortness of breath has improved, and it's been at least 10 days since symptoms first appeared. Persons who test PCR or viral positive for COVID-19 but do not experience symptoms should self-isolate until at least 10 days have passed since the date of the first positive test, and they continue to have no symptoms since the test. So if all of these criteria are met, a person is considered recovered. Also note that persons who test positive for COVID-19 antibodies through serological testing do not have to isolate unless they also test positive for the viral testing, or they're sick with COVID-19 symptoms and have not yet met the criteria I just described. So, as we move into the weekend and it looks like it's going to be beautiful weather-wise, you're probably planning or thinking about how you could get together with friends or family. Here's some tips on how to gather safely. Keep your guests to 10 people or less. Wear a face mask, especially if you're gathering indoors. Avoid buffet-style food and wear gloves to serve food. Another way to deal with food serving is to set up a buffet with foods covered and gloves or separate utensils for serving food provided, and only one person at a time at the buffet line. Or just have one person do all the serving of the food. Use disposable plates. Continue to practice physical distancing. Spread out lawn chairs or other seating and have plenty of room to move around so you maintain that 6-foot distance between people. Clean surfaces before, during, and after your event. Provide individually packaged drinks, or better yet, do BYOB or bring your own beverage. Hold gatherings outdoors whenever possible. If you must gather indoors, open the windows and screen doors for increased ventilation. And most importantly, have high-risk family and friends join virtually and have them not come in person. And remind those attending to stay home if they have any COVID-19 symptoms. So as we plan for the months ahead and the weekend, remember to always be thinking about putting space between yourself and others all the time. So let's all continue to be safe, be smart, when in doubt, don't go out, and remember, we're all in this together.